Hello and welcome to Williams Mullen's Benefits Companion, a podcast that helps employers navigate the complex legal challenges of managing their employee benefit plans. I'm your host, Brydon DeWitt, and today I will discuss new group health plan service provider compensation disclosure requirements. So it's hard to believe, but it's been about 10 years since the Department of Labor issued regulations under ERISA Section 408B2 that required service providers for retirement plans who receive compensation from plan assets to disclose to plan fiduciaries the direct and indirect compensation that they receive in connection with providing services to the plan. These regulations are important because not only is it a mandate for the service provider, but it also is important for plan fiduciaries to ensure that their service providers provide the appropriate disclosures and then review those disclosures to determine whether the plan's fees that the plan is paying for the service provider, whether those fees are reasonable. Because if the fees are not reasonable, it results in bad things, ERISA prohibited transactions and fiduciary breach. So we've had these regulations for retirement plans under 408B2 for 10 years, but these regulations did not apply to welfare benefit plans. Well, last year, the Consolidated Appropriations Act of 2021 amended ERISA to require certain group health plan service providers to disclose to plan fiduciaries information regarding the direct and indirect compensation that the service provider expects to receive. And so this new rule applies, it applied a year after the enactment. So this new rule applies to contracts entered into, extended, or renewed for group health plan service providers on or after December 27th, 2021. So as of today, these rules are in place. And recently, to help service providers and plan fiduciaries understand these rules, the Department of Labor issued Field Assistance Bulletin 2021-03 that fleshes out some of these requirements under the Consolidated Appropriations Act. The Department of Labor has not yet issued official regulations on the new service provider disclosure rules for group health plans, but fiduciaries and service providers are to use a good faith, reasonable interpretation of the rules as guided by Field Assistance Bulletin 2021-03. So to sum up some of that guidance, the Field Assistance Bulletin explains that this new requirement applies to persons who provide brokerage services or consulting services to ERISA group health plans if they expect to receive $1,000 or more in indirect or direct compensation in connection with their services to the plan. And the Field Assistance Bulletin makes it clear that what a service provider calls themselves is not all that relevant. So even if a service provider does not refer to themselves as a consultant or as an insurance broker, whether that service provider is subject to these rules is really dependent on a facts and circumstances analysis. So whatever they call themselves, if they are providing brokerage services or consulting services and expect to receive $1,000 or more in direct or indirect compensation in connection with services to the plan, indirect compensation may be commissions that they receive from an insurance carrier, then those service providers are subject to these rules. The disclosure must be provided reasonably in advance of the contract being entered into, extended, or renewed. And again, this applies to contracts entered into, extended, or renewed on or after December 27th, 2021. These rules apply to self-insured plans as well as fully insured group health plans. And they also apply to limited scope dental and vision plans those types of plans are often not subject to a lot of the rules that apply to standard group health or group medical plans. These rules do, however, apply to limited scope dental and vision plans, and the rules apply to large and small plans. So a plan that has under 100 participants is still subject to these disclosure rules. How the compensation is disclosed, the Field Assistance Bulletin provides that, it's really, until regulations are issued, we are under a good faith compliance situation, but you can refer to the regulations that exist for retirement plans under ERISA Section 408B2 to give service providers some guidance and fiduciaries some guidance as to what the disclosure should look like. Often with insurance brokers and consultants, the amount of fees may not be known when they enter into the contract. There may be a per participant fee, or there may be commissions. And so the Field Assistance Bulletin provides some guidance that the disclosure can provide a monetary amount. It can provide a formula for how the fee is to be determined, or it can state a per capita charge per employee to explain the fee. If those types of descriptions aren't really feasible, another method would be to show compensation ranges of, range of compensation that the service provider may receive. So here we are. We have now a service provider disclosure requirement that is very similar to the one that applies under ERISA Section 408B2 to retirement plans. And so plan fiduciaries need to be aware that as they enter into, extend, or renew contracts with brokers or consultants with respect to group health plans, that they should be receiving this disclosure from the service providers. That'll wrap up our discussion about the new employee benefits broker and consultant compensation disclosure requirements. If you have any questions or suggestions for future episodes, please contact me. You can also visit our employee benefits page at williamsmullen.com/employee benefits. There you can find out more about our team, as well as past episodes of this podcast and legal alerts. Be sure to subscribe to this podcast to be notified when our next episode posts. Thanks for listening.